This is the plain X-ray of a 27-year-old rugby player who sustained an acute superior dislocation of his left sternoclavicular joint. The arrow shows that the medial end of the clavicle has been dislocated superiorly and medially. The mechanism of injury is a direct force on the outer end of the shoulder, depressing the clavicle, dislocating it both superiorly and medially. The stabilizing ligaments of the sternoclavicular joint are the anterior sternoclavicular ligaments, and behind those the posterior ligaments, and we can see both of these in the axial view. There are also the interclavicular ligaments, which prevent superior translation, and the costoclavicular ligaments, which also prevent superior translation, but also involved in both anterior and posterior stability. In this patient, the key ligaments that have been damaged are the costoclavicular ligaments and the interclavicular ligament. On a coronal T2 MRI scan, we can see that the costoclavicular ligaments have been damaged and also the interclavicular ligament that has been torn off. On the axial view, we can see that both the anterior and posterior sternoclavicular ligaments are intact. To stabilise this patient's joint requires a reconstruction of the costoclavicular ligament, as the ends of the ligament are so small and irreparable, and also a repair of the interclavicular ligament. To achieve this, we undertook a superior to inferior 3.5mm drill hole through the clavicle at the point of the lateral end of the costoclavicular ligament. A gracilis hamstring tendon autograft was then passed through the drill hole, behind the first rib, retrieved from underneath the first rib, and then brought round to the front of the clavicle. The clavicle was then reduced and the ends of the tendon tensioned and sutured together. This repair was then protected using a dog bone implant passing between the medial end of the clavicle and the sternum, and the interclavicular ligaments were then sutured back into position. A post-operative CT scan demonstrates that the clavicle has been reduced. We can see the superior to inferior drill hole where the hamstring tendon has been passed, and also the ends of the dog bone that are protecting the repair. If you would like to know more about the sternoclavicular joint or any other aspects of shoulder surgery, visit my website www.cambridgeshoulder.co.uk or my YouTube channel, Cambridge Shoulder.